Hello friends, I am Dr. Arun Bhanot. I am currently working as Director of Spine Services at CK Birla Hospital, Gurugram. So today in this video, we are going to talk about a very important condition of the spine known by the name scoliosis. So scoliosis is a condition of the spine where our spine, which is supposed to be very balanced and straight under normal circumstances, tends to develop a sideways curve. Like if the spine is supposed to be straight like this, it tends to develop a sideways curve. So the patients tend to have a sideways bend and their shoulders can get abnormally aligned. Normally this disease affects the young adolescent girls. Usually it's noticed somewhere around 9-10 years, and maximum age group for this to be noticed is around 15 years. So between 9 and 15 years, people tend to notice that some of the young girls develop this abnormal curvature. The etiology, or what we call as the reason for this, is not clearly known, but there are supposed to be some genetic factors involved here. And besides creating a cosmetic deformity in young adolescent girls who are also becoming conscious of their body and self-image, it creates a significant amount of psychological stress to have an abnormal appearance. Besides having an abnormal appearance, it also creates imbalance of the spine, which is supposed to be a normal, straight, harmonious, balanced spine. So this may not cause any clinical symptoms in the beginning, like any back pain because of this, but as they advance in age and reach middle age and old age, this abnormal curvature can lead to faster wear and tear of the spine, leading to early onset of degenerative spine disorders like back pain, sciatica, and significant interference in their day-to-day life activities. So it is important that this scoliosis is recognized early. Nowadays there are a lot of organizations that start school screening program to check for scoliosis in young adolescent girls, and we also recommend that parents who are raising up these children in this age group look consciously for any abnormal tilting of their child's shoulder or the child kind of leaning on one side, which is not by choice but happening by compulsion because of the disease. So if you notice, it is recommended that you should see a nearby spine specialist to get her checked, and if required they will do some x-rays to find out the scoliosis. Now if the scoliosis does develop and is detected, there is no need to worry. This is a fairly commonly treated disorder nowadays and can be safely treated using the modern scientific advancements. The only challenge is that you have to first quantify to what degree the scoliosis is, and has the child matured enough physically, general health condition, as well as the spine has become stronger to undertake the stress of the surgical treatment. Normally the scoliosis is treated surgically, where the surgeon has to put in some screws and rods to align the spine, and then join those screws with rods to correct and bring the spine back to normal alignment. This is done with deploying modern gadgets like intraoperative x-rays, navigation techniques, neural monitoring to check that the nerves are also preserved while correcting the patient. It is imperative that the scoliosis is treated at a reasonable age. I will not say very early, but at a reasonable age, before it becomes non-flexible or becomes extremely rigid, because rigid scoliosis requires much more effort and also puts the child at a higher risk of treatment. Thank you.